You're listening to the True North Success Podcast. Real stories of personal, professional, and financial wins from Alberta's best. With your hosts, Gary Ma and Amy Kim.
Hey everybody, welcome to the show. Today my special guest is Dr. Rebecca Jane McAllister. She is a professional healthcare provider and runs her own clinic in Calgary and provides services at the University of Calgary. Dr. McAllister provides chiropractic and acupuncture treatments to patients, and she offers the GLAD back program as part of her practice. It is my pleasure to have Dr. Rebecca Jane McAllister on the show today. Welcome to the show.
Thank you so much for having me.
So, Dr. McAllister, I gave a quick overview of your success, but can you fill in the details of what you do, who you serve, and how long you've been doing this for?
Yeah, of course. So, as a chiropractor, we are musculoskeletal experts, and that is our scope of practice. So, anything related to the muscle, nerve, bone, or joints of the body. Mm-hmm. I have a particular interest in the world of low back pain. So everything from your, weekend warriors, gardening, snow shoveling, sprain strains, to disc herniations or sciatica, to spinal stenosis. And that's kind of where the GLAD Back program fits in. And so the GLAD Back program is a group education and exercise rehab program, and it was developed in partnership with the University of Alberta and the University of Southern Denmark. And the whole purpose of the program is to teach people how to self-manage their low back pain through education and exercise rehab. I've been in practice now for, I think, just over 5 years, and I've practiced a little bit everywhere. I've been in PEI, Ontario, the Northwest Territories, and Alberta.
Right on. So what got you into chiropractic and acupuncture care?
Yeah, good question. So when I was younger, I danced at a very high level and I played competitive soccer. And some days I was able to do those physical activities without issue. And other days I had one-sided knee pain and opposite-sided ankle pain that was very limiting in my movement and what I was able to do. And every doctor I saw at the time said, oh, you're young and you're athletic and you're growing and it's your body telling you to slow down and take a break, which at the time made sense. Retrospectively, not so much. And it wasn't until I was in a ballet class and my teacher was correcting my posture on an exercise when she said, oh, did you know you have more muscle on one side of your spine than the other? And I said, no, I didn't. And she's like, well, you might want to follow up with your pediatrician about that. And I said, okay. And I went home and I told my mom and, we got booked in with the pediatrician and my doctor was like, I don't know what to tell you about your knee and your ankle, but I'm happy to take a look at your spine. And he did. And he ended up sending me for x-rays. And it turned out that I had scoliosis, which is a curvature of the spine. And so from there, I was referred to a plethora of healthcare professionals and specialists. And I was braced with fitted and braced for a back brace. And I started having more frequent knee and ankle pain, and I started having back pain. I was probably about 14 years old at the time and didn't have a great attitude about it. It was kind of like, this sucks. Like, I'm having more frequent knee and ankle pain. I'm taking less time, more time away from dance and soccer. And now I'm starting to have back pain, which I've never had before. And my pediatrician was ahead of his time back then, and he recommended that we book in with a chiropractor. And I remember my mom booked the appointment for like a Saturday morning, and I was like, man, this is literally the last place I want to be right now. It's like another doctor's appointment on a Saturday morning. But it was the chiropractor who took the time to explain how the curve in my spine related to a leg length discrepancy, which then contributed to knee and ankle pain, and how, because now we were addressing the curvature in the spine, how that was related to the increase in pain and discomfort I was feeling. And so, at 14, I was like, cool, if I could do that for somebody else, that would be very rewarding in a career. And so in grade 9, I decided I wanted to be a chiropractor and just mapped the path out so that I could be the strongest candidate for chiropractic college. And then the best healthcare professional I could be post-grad.
Wow. I mean, so really it was from your personal experience of having your own back pain and wanted to help others not, at least not have that back pain, but help cure.
Yeah, well, and help people understand, right? Like I think
Right.
when I reflect back, I think the piece that was so critical for me at the time is the fact that this chiropractor took the time after he did his history and physical exam on me to then piece it all together and help me make sense of my lived experience and what I was going through so
Yeah.
that I could make sense of it and I could understand it and it didn't feel so daunting or overwhelming or unpredictable.
Right.
And we know in the research that that education piece is so critical for outcomes and prognosis. And so I think for me, I was like, if I could be in a position where I could provide that similar sort of context or education to somebody else who is in a similar position to me, it would be very rewarding and worthwhile.
Right. So what kind of sets you apart from the competition? Like what comes easy to you that others might find challenging?
Yeah, I think that's a really good question. And I think when I'm talking to patients in particular, what I really want to enforce is when you're looking at adding somebody to your healthcare team, the relationship, the rapport, the trust, the ability to ask questions and feel confident you're going to get answers that you understand that will help you make an informed decision as to how you want to proceed with your healthcare. I think that's of highest priority, as opposed to why should someone come see me versus the person down the street or a different healthcare provider altogether. I think when somebody is able to say, okay, I'm coming to you for your expertise, but I feel comfortable enough to also ask you questions about why you're recommending the treatment plan you're recommending. And it's
Right.
explained in a way that I understand so that I
Yeah.
can be a part of that shared decision-making process. Again, I think that's when you really start to see really positive outcomes in cases and people start to feel empowered to be an active participant in their own healthcare.
Right. So just being part of, I guess asking questions and then helping and educating the patient through that process.
Yeah, I mean, I think that's a big piece of the puzzle, right? I think as humans, we really like black and white answers, right? We would really like to say, this is the reason I'm having that. And if I do X, I'll have Y outcome. But it's often so much more multifactorial and there's so many moving pieces to it, right? And so when someone is coming to see me, for example, with back pain, yes, we can address the muscle and joint dysfunction, but it's also important to talk about sleep and stress and diet and physical activity and add in exercise rehab that maybe interrupts any repetitive cycles that might be contributing to the back pain experience. And so again, I think having this more well-rounded full picture and addressing all of the pieces
Yeah.
and then being able to communicate that back so that then the person or the patient has that understanding so that they then feel empowered between visits to be an active participant in their recovery. I think that's when you really start to see really good outcomes with people.
Right. With your success, what kind of tips or suggestions would you give someone who wants to be more successful? It could be business related. It could be, from a care point of view.
I think something I've learned over the last few years is there is a personal definition of success. And what success means to me might not mean what success means to somebody else. And so I think if someone was asking, what more could I do to be successful? My question back would be, well, what would success look like to you? And I think that really boils down to understanding your values and what is important to you and how you want to live your life day in and day out. And I think once somebody can get clear on those pieces, you can then start to develop a plan or a schedule or an environment that then supports those values, which then will lead you to intrinsically feel that success as per your definition.
Right. So I guess looking at what your definition of success is and then figuring out what that looks like and then moving towards it type of thing.
Yeah, right. And I think too, like if you're trying to meet somebody else's definition of success, you're probably not going to feel fulfilled if it's not also your definition of success.
Right.
And that's when I think it's important to be able to take a step back and say, okay, what is meaningful to me? How do I actually want to be living my life day in and day out? How do I want my personal life to look like? How do I want my professional life to look like? And then I think once you have a clear understanding of that piece, you can then start translating that into your everyday life.
Right, right. What's one of the biggest challenges that you've had to overcome in your career, and how were you able to turn that into a positive?
So I think for me, I graduated in 2019. By the time I had all of my paperwork in place and my license, it was 2020.
Okay.
And, I started practice out in Prince Edward Island as a locum doing a mat leave coverage weeks before COVID hit. And so I've really had to pivot a lot.
Okay.
And again, knowing that I started in 2020, my professional career, and knowing that it's now early 2026 and hearing that I've practiced in PEI, Ontario, the Northwest Territories, and Alberta. I've been a locum where I've done mat leave coverages for people who are on mat leave. I've been an associate at a practice where I've been on a, percent split. I've been a clinic owner. I think all those quote unquote starting over pieces is quite challenging because every time you make a move in business, every time I move to a new city or a new province, you're kind of starting year one of practice over again, right?
Right.
Rebuilding
Yep.
your reputation, you are rebuilding your patient base, you're doing a lot of networking,
Yeah.
you're really kind of pounding the pavement. And that has been challenging. It's been challenging to feel like I've repeated year one over and over and over and over again.
Right.
But I know I've done that because I'm very clear on what my values are. I'm very clear on how I want my life long term to look like and how I want to feel day in and day out. And I didn't want to compromise on that. And so I think all of those experiences in those different roles, in those different positions, in those different, rural, urban environments, different provinces and territories, they've been invaluable experiences that then help shape how I want to move forward and how I want to continue with my career and how I want my life to look like. And so even though it was challenging to make some of those hard decisions of, oh, this isn't right, I need to move on to the next thing, or this isn't right, and I need to move to a different city or province or territory, while navigating COVID-19.
Right.
I think it's just really solidified and clarified my values and how I want to show up in my practice and how I want to show up in my life.
Yeah, so it's really, really, you've been really able to take those challenges and learn from them, and then continue growing towards the way that you want to live. And it sounds like you're doing a fantastic job.
Yeah, thank you.
It sounds like things are going really well for you in your business. Like healthcare professionals and doctors make a very good income when they're actively working. The challenge is that when they're not treating patients or actively working, there's no income coming in. So that's definitely a bit of a challenge, especially looking towards the future when, you don't want to have to be working so hard. So some of them are looking at different ways of creating income and profits outside of work. Some of them look to invest in stocks, bonds, crypto, or using a financial planner. What are your thoughts about that at ways of creating income outside of your work?
It's also a very interesting question. I think for me, I really respect that, I went to school for 8 years and I have this scope of practice and area of expertise, but I'm also very acutely aware that I have a working knowledge in other aspects of life,
Right.
including financial. And so for me, it was really important to find a good accountant and a good financial advisor that I, again, could lean on, ask the good questions, make an informed decision, feel like I trust them to help guide me,
Yeah.
because they also went to school for prolonged periods of time and obtained their area of expertise, right? And so
Yeah.
I think that that's a piece of it for me. I think another piece that I'm learning about as an earlier in my career type of practitioner is really starting to explore how to diversify my income so
Okay.
that it's not solely and entirely based on one-to-one care, which I think is the very traditional model for a lot of healthcare providers, right? Whether you're a medical doctor, chiro, physio, massage, you have the person who books the appointment, you provide the service, you get reimbursed for that service.
Right. Yeah.
But of course, there's only so many people in a day I can treat where I feel like the first person of the day and the last person of the day are getting the same standard and quality of care from me, right?
Yeah.
Chiro is a very physically, mentally, emotionally demanding job.
Sure.
And again, one of my values is I don't want someone who ends up being my last person of the day to have a totally different experience after I've seen a full day of patients versus the
Yeah.
first person of the day when I've woken up and I'm refreshed and I'm ready to take the day on. And so when you start to map that out, you can very quickly start to see, okay, realistically, I can only see this number of people in a day, which means my maximum earning potential is X. And so I think for me, it's been, okay, well, what else can I offer that is aligned with my values? That's not one-to-one care, that can
Right.
supplement and diversify the income stream so that it doesn't feel entirely dependent on one-to-one care.
Right. Yeah, that's definitely a challenge for, if you're running a practice, whether you consider bringing on other people into your practice, which could help type of thing, or, looking at different ways of creating income passively as well. So,
Yeah, and it doesn't even have to, like, I mean, passive income is great, right? I don't think anybody worldwide would be opposed to passive income.
right.
But I think the easiest example that I could give right now is, yeah, I do offer one-to-one care, but I also offer the Glad Back program, right? And
Right.
that's a group education and exercise rehab
Okay.
program. And so
Right.
I'm able to work with and help more people in that hour than if I were to do one-to-one care. And
Right.
so offering both starts to diversify my income streams
Right.
and provides additional options
Yeah.
to patients who might be seeking care for low back pain. And so they can also then start to say, you know, I know my schedule. I know my life. I know one-to-one care is best for me, and that I'll do my exercises on my own time in between visits. And I've had other patients who say, I wish I was good at going into the gym, or I wish I was better at remembering to do my rehab kind of at my desk throughout the workday, but that's just not me. It's not
Yeah.
me. I'm not diligent about it. And so having a structured 1 hour time slot put aside in the week for this program works best for me. Right?
Right. Yeah. Yeah. As we're wrapping up our interview, what kind of exciting plans do you have in the works in the next 6 to 12 months?
Yeah, I think there are some exciting things on the horizon. And definitely always thinking again, how do I want to progress and move forward in personal and professional life while also staying true to my values. And I will say there are some exciting things on the horizon, but I am not in a position to publicly announce them just quite yet.
Okay.
So I'd say stay tuned.
Right.
Keep an eye maybe on my website, or I have a community email list. And so if you're interested in just staying in touch and learning more about what I do, I think that's a really easy way of continuing to hear of what is on the horizon as it unfolds in its due time.
Right. Dr. McAllister, that wraps it up today. Thank you so much for your time and sharing your insights and tips today. It was a real pleasure to have you on the show. Dr. McAllister, if people want to connect with you, what should they do?
Yeah, great question. Well, thanks for having me, first of all.
You're welcome.
It's always so lovely to have an opportunity to chat and kind of share a bit about how I've gotten to where I've gotten to and what's inspired me to be so passionate about the work I do. Again, for those of you who are interested in maybe staying in touch or reaching out, I think everything you would need to find is on my website. It's very, I would say, very detailed. And so if you visit www.
And what is your website?
Yeah, so if you visit www.drrebecca.ca.ca, you'll find information about my programs and services. You'll find blog post content. You'll find other media, podcast type things that I've done before. You can find my social media. You can sign up for my email community list. So you can find my phone number and my fax number and my direct email and all different ways to contact me. So I think if you visit my website, I feel very confident you'll find what it is that you're looking for. Right
on. You're also on LinkedIn as well.
Yes, yeah. So I do have a Facebook, Instagram, and LinkedIn account as well. And again, you can find the direct links to those off my website, but if you search my name, I'm sure you'll be able to find me on Facebook, Instagram, and LinkedIn as well.
All right. Thank you so much.
Thank you.
Okay. Bye-bye.
Want to share your success story? Apply to be a guest at truenorthsuccessshow.com/guest. We'd love to hear from you.